Good afternoon and welcome to our presentation of CILNWF intake process. Thank you for spending part of your afternoon with us, and we hope that we put together a presentation that will be both informative and helpful to you as you learn more about what CIL is and what we do and our intake process. I'm Danny Broxson. I'll be your presenter. And just for your information, closed captioning is available by hitting the CC button on your on the Zoom, and a transcript. You can also get a transcript. It is also being recorded, so we're going to post this on our website as soon as we are able, and we will make sure that you have access to this if you miss any part of this. And we are still letting people in the room, and that's a great thing. So I just wanted to go through and a little bit of housekeeping. If you have questions throughout the process or throughout the presentation, if you could put those either in the chat or we can wait until the end of the presentation, that would be great. And you can always contact us if you want to ask a question later. You can contact us at info@cilnwf.org. So today we're going to talk about the intake process and what it takes to become a consumer. And we're going to talk about the issue of once you've contacted us, what next? And ultimately that's going to depend on a few different things. So next slide. But before we get started, we're going to talk about the initial intake, the initial contact with CIL, and it usually involves a phone call. We usually get calls from people with all types of disabilities, all ages, and they call and ask questions, and they tell us what they need, and then we develop an assessment, try to assess what their need is, and then come up with a plan, the appropriate level of support. We talk about goals and a personalized plan, because what works for you may not work for somebody else. Everybody has different disabilities, different abilities, and so we want to make sure that those goals and whatever plan we come up with is for the individual with the disability. So next slide. So a little bit about us before we dive into the application and all of that stuff. CIL was founded in 1980, of course, the Center for Independent Living, and the organization is run for and by people with disabilities. So we want to provide support and transform lives by working with and on behalf of people with disabilities and dedicated to their success at home, at school, and in the community. So whatever that independent living looks like to you, that's what we want to help you accomplish. And we don't do it for you, but we work alongside you to make sure that you have the tools to be as independent as you want to be. And we can talk more about that. And it's usually a process, but we talk a lot about that and what that means to the individual. So next slide. So we have 5 core services, and I'm not going to spend a lot of time on either one of these or any one of these, and these are not in any order of importance, but we do information and referral, independent living skills training, peer support, which is a person with a disability talking to another person. We do individual and systems advocacy, and we do youth transition and nursing home diversion. So any number of those items or topics can be converted into goals, and we open up files. The only one we probably would not open a file for would be information and referral, and that's if you are calling and you need community information, and we can provide that information for you. We wouldn't necessarily have to open a file for that unless it was more involved and you needed more assistance. So next slide. So we are, of course, trying to connect people with and without disabilities, information and assistance to ensure that they have access to resources. So that could be accessibility, and accessibility could be programs, it could be buildings, assistive technology. We have the FAST program, which is the Florida Alliance for Assistive Services and Technology, and that's under the umbrella of CIL that we have here in the office. And that's a different program. We can help with technical assistance, benefits counseling, education, housing. What we want to be is the one-stop for all people with disabilities. So if you have a need or you're not sure about your next step, or you're not sure about the information or the resources available, we want to be that go-to organization that people call. They can ask us questions, and if we don't know the answer, we can either connect you with the people that do or work alongside you to find the answer that you're looking for. And we don't pretend to have all the answers, but we can work with our community partners to get those answers and make sure that you get pointed in the right direction. So next slide. Independent living skills can be any number of things. It could be decision making, goal setting, as the slide says, but it might be personal and health and wellness. It might be talking about different things about your life and your disability and the challenges you face. It could be learning how to use a particular piece of equipment so that you can maintain your independence and stay in your own home rather than having to go to a rehab facility or a nursing home. So our whole goal is to keep people out of nursing homes. A lot of the independent living skills that we do revolves around equipment. It revolves around money management and personal finances and helping people manage what funds they have. So, and some other things that we talk about would be disaster preparedness. You know, living on the Gulf Coast, we're all familiar with hurricanes and storms. So we try to keep people informed and up to date on disaster preparedness. But those are some things as far as independent living skills are concerned. And it could be something, if you have something that you're looking for that you're not sure and you want to learn more about it, we can adapt a plan for you and work on those skills as well. So just because it's not there on the screen doesn't mean that we don't do it. So next slide. We also have peer support. The interesting thing about our organization, if you don't already know, our organization is, like I said, run by and controlled by people with disabilities for people with disabilities. So all of our staff have some sort of disability. And when you come to CIL, you will see people with all types of disabilities. We have people with hearing impairments, visual impairments. I myself have cerebral palsy and walk with crutches. And our hope is that by talking to somebody who has a similar disability or similar challenge in dealing with a disability, that we're not just saying, here, go here and do that, but we can help you. We can come alongside you and support you because we've been there and done that. But we have a support group that meets twice a month, and we can share that information with you if you are interested, or if you know somebody that might be interested. It's for people with disabilities and also caregivers. So next slide. Individual and systems advocacy. So we want to make sure that we are educating people and helping them to know what their rights are under the Americans with Disabilities Act. And that can be a wide range of topics and information for individuals, but we also, systems advocacy is making sure that the community is accessible, making sure programs are accessible, making sure curb cuts and disabled parking, making sure that ramps are appropriate and done well and done right, so that when you go into a business, those things are accessible to all people with disabilities. So if you see something out in the community and you're not sure about it and you think there might be a problem, you can contact us and we can go out and do an assessment, making sure uh, those things are accessible. And we try to do that in a way where we partner with the business or partner with the organization to make sure that they know that they are, it's not just the law that says they have to do that, but they want to do it because these are people with disabilities and their families, and they live in the community with you, and they spend their money. They go out and shop, and they spend their money. They go to places, and they want to go to places, and so we want to make sure that those things are accessible. Next slide. The transition programs, we can help youth with disabilities if they're transitioning from school and they want to start out in the workforce. We can help them with skills and helping them get ready for job interviews, helping them to learn skills that would help them get a job and to keep a job. We help them to advocate for themselves and do all of the things that they need to do to be successful in the workforce if that's what they want to do. And then also we do community transition. Obviously, I had said that we want to make sure that if you have the ability and you want to live on your own and in your own home, we want to give you every opportunity to do that and keep you out of a nursing home or out of a rehab facility with support and things that we can do for individuals to make sure that that they get to live where they want to live instead of being told that they have to go there because there's no other option. So next slide. So here's a few of our success stories. We have durable medical equipment that we can loan out. There's no charge for any of the equipment that we provide. We do take in donated equipment. We also have grant money that allows us to purchase new equipment when it is available. And so we are able to turn around and issue that equipment, which again allows people to be independent and stay in their own home and help them to be as independent as they need to be. So we have durable medical equipment. We have a telephone program through the Florida Telecommunications Relay Incorporated that allows people that are hard of hearing have phones that they need. So those are just a few things, and everything is subject to availability, of course, but those are a few things that we provide to help people to be able to stay in their homes. Again, the FAST program is a wonderful program that allows people to come in and try out items on a try before you buy basis, on a temporary basis to make sure that it works for you. And then if you don't have the funding to purchase that equipment, then we can help you. We have ways to help you get that equipment that you need. So, and that's part of the assessment that we do for the intake. So, so we've been here for 45 years now. And again, we are and provide high quality services for all types of disabilities. Doesn't matter how old they are, what the disability is. And to everyone's credit, to all of our staff, to our board, to everybody, our success rate and the feedback that we get is that 96% of our consumers are satisfied. So our goal is always 100%. It's always to be able to make sure that everybody has what they need and that they're able to get the services that they need. We also know that sometimes that's difficult, sometimes that's a process, and they don't always get everything that they need. However, we want to make them and empower them to get what they need, even if they don't get it from us. So that I think that's where that 96% comes from, because we make sure that they feel empowered, that they are at least pointed in the right direction and they're getting what they need. So, and our whole goal and what we come to work for every day is to help people with all types of disabilities. That's what we love to do. That's what we're good at. And so that is us in a nutshell. Next slide. So I'm going to go through and ask or go through a series of questions that are all part of the intake process. We hear these a lot. We get these questions a lot, and we're able to go out in the community. We meet a lot of people. We talk about the services that we provide and the things that we can do. And then we thought it'd be kind of fun to talk about what the intake process looks like, because some people have a lot of questions. So the first question, and again, these are in no order of importance. Do you need to call to make an appointment? We do see walk-ins. However, calling for an appointment is very important because, for several reasons, we are a very small staff. So we try to, and we serve 4 counties: Escambia, Santa Rosa, Okaloosa, and Walton counties. So in order for us to be able to help people and do it efficiently and in the best way possible, we do encourage them to call and to make an appointment, because at that particular point in time, we can do an assessment. We can talk about their disability. We can talk about the things that they need. And if I know that I've talked to you and I know that we've made an appointment, then I can also reach out to the rest of our staff if there's something that I need to make sure that you get what you need, and make sure that you have the equipment that you need, and the process runs smoothly. We do encourage appointments. Now, we also understand that at different points in time, different people, different circumstances, sometimes either they don't know or they have an urgent need, and we will certainly see walk-ins, but it's better for us to be prepared, and it's better for us to know what you need, and that way we can have what you need to make the process more efficient. So next slide, or next question. So basically, the intake process is usually done through a phone call. Sometimes we get people that come in and they'll ask specific questions, or they'll come in for their family member and ask questions, and then we talk about what the process is. There is an application process, and basically, I think let's say, for example, if you're getting a piece of equipment, it's a 6-page application. It's a lot of it is just demographic information, telephone number, address. They'll ask you what your marital status is, the best way to contact you. They ask you things like your household income. Now, that's on a range. We try not to ask specific questions because it really doesn't matter. As long as you have a disability or identify as somebody with a disability, we're going to do our best to provide the services that you need, or at least get you to the place where you can get the services that you need. So a lot of it is just demographic information, pretty much standard information that you would fill out at any doctor's office or any other place that you would fill out an application for services. And we use that information. A lot of it is for reporting purposes, but we use that information to help you better, to get to know you, to figure out what it is that you need. And we're here to help in that process. It's pretty easy to fill out, and the main thing is to make sure that we have your signature where we need signatures, which means that we've gotten your approval, we've established the things that you need. So it's a fairly easy process, but if you need help with that process, we're here to help and answer any questions you have. So basically, you would call and make an appointment, and then you would come in at that designated time and meet with your counselor. Usually, if the phone conversation goes well and we get a lot of information, it goes even more smoothly and more efficiently. But when you come in, it allows us to talk to you even more, get to know you in person, and get to establish whether or not is this all you need, or in case we've thought of something else or can recommend something else. Let's go to the next question. So how long does that process take? Now, everybody is different because no disability is the same, and nobody's asking for the same thing, and nobody gets to their destination at the same time. but for just for example, what I try to do is I'll block off an hour. If I know if I've talked to you, I know what you need, or if you're coming in to complete the process, I try to block off an hour. Now that doesn't mean that it has to take an hour, of course. Um, Sometimes we know exactly what we need. People will come in and they'll complete the paperwork. They will get exactly what they need, and they're in and out, and everybody's happy. Sometimes people come in and we start talking, and we find out they need a lot more services, they need a lot more equipment, or the process takes a little longer. Um, so it just depends. But I do block off an hour because I don't like to rush anybody. Um, and I want you to feel comfortable and feel like you can take as long as you need to. Because when you're happy, then we're happy and we're successful. So next question. So what kind of documentation do you need to complete the CIL application? So the application itself is very easy. It's pretty much self-explanatory. There's some demographic information, like I said, but the only documentation that I really need to open a file for you, and it will depend on a couple of different things. One would be a state ID, okay, with your picture on it. It can be, I believe it can be also a military ID if you have a military ID. It doesn't even have to be from the state of Florida. We just need to be able to have a picture that says you are who you say you are. And because we're having you come in and self-identify as somebody with a disability, that's basically what we need for to open the file. Now, there may be other documentation, and I wanted to mention this because for our purposes, we don't keep medical records. We don't want to know, we don't require medical documentation to be able to provide services. So we don't keep those records. However, if we were to refer you to another agency or another organization, their process may be different and they may require certain documentation that we don't require. So just be aware of that. But it's a very easy process, and the documentation you need is very minimal. There's always an exception to the rule. So, that is subject to change or, depending on what you need. But the documentation that you need is very simple. Next question. So what is your responsibility as a consumer? It's sometimes it's easy to come in and say, I need this. And I think I could speak for all of us here. We want to make sure that you have what you need and that we're giving you the best service and the best customer service as possible. But in order for us to do that, we need you to work cooperatively and truthfully with us to get the information that we need so that we can make sure that you have what you need. So, for example, your responsibility would be to communicate with us, if at all possible, and every opportunity possible, to make sure that we know what you need. And if you aren't sure or you don't know, or if something's not working, then we need to know how to help you better. So communication is key. Providing us accurate information helps us to make sure that we have the equipment that you need and available to you, making sure we have the right size, make sure we have the right, something that's going to be safe for you. And I can think of a couple of different examples of that, making sure that if we ask you for information, that you are able to provide that information so that we can also get back to you in a timely manner, and make sure that we can get that equipment to you and provide it for you as quickly as possible. Because of course, if you didn't need the services and you didn't need the equipment, you wouldn't be here. So working cooperatively and truthfully, and the follow-up is also important. One of the things that we are really working on and trying to do a better job is reporting to our grantors, and they want to hear success stories. They want to know that the equipment that we're giving you, the services that we're giving you, are indeed helping you and are indeed life-changing. And one of the ways that we do that is by asking you to share your story. Share your story, to take pictures, to let them know that the services that we provide are important and necessary. And so when we ask you to provide those pictures and tell your story, of course, we don't want to put anybody on the spot or make anybody uncomfortable, and you don't have to do those things. But telling your story is very powerful, not only for those grantors, but for other people who might be at home wondering if anybody cares, wondering if there's any services, wondering if they can get equipment or how that might help them. Your stories are very inspiring to people. So we ask you to tell your story, to help us out so that we can get more grant money and help more people and serve a larger population in the community. Because we all know somebody, whether we have a disability or not, we all know somebody that does. And the one thing that nobody likes to talk about is that anybody can come down, or a disability can happen to somebody at any moment and point in time. So not to be a downer or anything, but that's just the truth and the fact of the matter. So that would be your responsibilities. Just help us help you, and give us the information that we need so that we can help you and make sure that we're helping you in the right way. So next question. Can a family member open a file for a consumer? The short answer is yes, but we need documentation that allows that family member to open a file for you. And one of the main way that happens is through a durable power of attorney. That would give somebody the power to come in and open a file for you. And on our application, there's places for consumers to sign, and then there's places for consumer representatives to sign. So we have a lot of times, and that is something that we would keep on file. So you would bring a copy of that durable medical power of attorney, or durable power of attorney, and we would make a copy of that. We would keep that in the file. That way, if there was any question, we would know that that designated family member can come in and sign and open a file for you. They can get equipment, they can get services, whatever they need. That also applies to guardianship. If you, maybe you're not the parent of a child, but you are the guardian, we would have a copy of that on file, and that guardian would be able to come and conduct business and get open goals and do everything that a consumer would be able to do, as long as we had that signature. The other thing along with that documentation would be the consumer's ID, picture ID, and the power of attorney's ID. So we would keep that on file so we could verify that they are who they say they are, and they have the right to do whatever they need to do. And then they could come in and sign the paperwork. So that the short answer is yes, but there are some stipulations to that. And we try to work with the family, even if they don't have the power of attorney, and helping them open the file. We work with a lot of social workers and home health care workers to get paperwork back and forth to where it needs to go. But the main thing on the application is the consumer signature. And it also, we want to make sure that you know as a consumer that when your opinion or your needs differ from those, or if your family's telling you one thing and they think you should do this, we're always going to look out for the consumer's needs and the consumer's wants above the family. So, and the power of attorney, that just gives somebody the opportunity to open the file and do what they need to do. But we need to make sure that the consumer knows that they are in charge of their goal, they're in charge of what they're asking for, and we want to make sure that we look out for them first. So next question. So if you're unable to come into the office, and it is nice and wonderful when we get to meet all of our consumers and they all come in the office, because number one, it's about independence. It's about coming into making an appointment, being independent, coming to get what you need, and being part of that process. So we love to meet with our consumers in person. We love to talk to them. We love to get to know them. But there are circumstances where they are not able to come into the office due to health reasons, or maybe it's a geographic issue. So again, we work with family members to make sure that if you need paperwork sent to you, we can either mail it to you, we can email it to you, they can pick up paperwork, and they can be the gopher and run between you and us to get what you need. But ultimately, again, it is your decision as a consumer, and we would need your signature as a consumer on those forms if you don't have a power of attorney or don't feel like you need one or don't want one, and that is perfectly fine. We just need to know who that person is, and your consent to have them come and pick up that paperwork and to pick up the equipment or pick up whatever it is that they're supposed to be here for. So if you can't come into the office, we have ways around that. It just depends on the situation. It depends on the person. It depends on what we're able to do at that particular moment in time. And that goes back to making sure, the intake process, making sure that we have what you need. And that's why making an appointment and talking to an ILS counselor is so important, because we don't want you wasting your time coming up here to get something and then find out we don't have it, or wasting your time coming up here and then find out the person that you came to see and that you need to see is not here. So that's one of those important things again. So let's go to the next question and see. Now, this is very important, and this is something that we take very seriously. Is my information confidential? Part of the intake process is there is a confidentiality waiver, and that is a waiver that we only talk to people that you give us permission to talk to. So somebody in your family, for example, you may list them as an alternate contact, but unless they have signed that waiver giving us permission to tell them anything, they can't call us and say, well, I was wondering how my mom's doing, or what the status is of this equipment, or what the status is of the goal. We can't discuss those issues with anybody unless the consumer or the power of attorney has given us permission to do that. One of the major ways that we use confidentiality waivers is if we were to refer you to another agency, but we're still gonna follow you and follow the process and make sure that you're getting what you need. It's very important for us to be able to talk to those agencies and the representatives in that agency to make sure that you're getting the services that you need. So we may ask you to sign a waiver, for example, if you're needing help with Social Security and you give us permission to talk to Social Security, that's a wonderful thing. If you give us permission to talk to your Aunt Ruth, that's a wonderful thing. But we don't share any information with any person or outside agencies without your consent. And that's very important. Because it's about you being in control. It's about you having the dignity to live independently. And if you don't want to share that information, or you don't want somebody to know what's going on or what you're doing, that's important. And if it's important to you, it's important to us. Now, I will say it's important to have that family network and that family support, and to help you throughout your journey of independent living, whatever that looks like. So we can encourage that, we can talk about that, but ultimately we do not share confidential information with any outside agencies or people without your consent. So bottom line. Next question. We get this a lot, and we ask, it's part of the intake process. They do ask you if you have medical insurance. And some people have private insurance, some people have Medicare, Medicaid. You do not need medical insurance to receive CIL services. Now, we will try to encourage you that if it is something that insurance will cover, to call and find out what you're entitled to, find out what your insurance does cover. And if you can get that through your insurance, it's very important because that's number one, that's what you're paying for. And if insurance is, if you have the insurance coverage and they're going to cover the equipment that you need, then you probably need to go through your insurance. However, there's a lot of things, as you may already know, that your insurance does not cover. For example, they don't cover shower chairs. They don't cover anything that involves toileting or bath. They don't cover. Sometimes you have insurance, but it takes a while, and maybe the copay is too high, and you have the coverage, but you would have to pay a copay or a monthly fee, and you can't do that. What we can do is we can loan this equipment to you until you get what you need from your insurance, and then you can bring it back to us. And then we can use that equipment for somebody else. But you are not required to have medical insurance. As a matter of fact, the equipment that we issue, the long-term equipment that we issue, things like durable medical equipment, after a certain period of time, it becomes yours to keep. So, and then if you don't need it anymore, don't want it anymore, if your circumstances change, because sometimes disability may be something that's going to heal up, like a broken leg or a temporary disability, then you can donate that back to us and we can reuse that for somebody else. But you do not need medical insurance to get what you need. So, or to get CIL services. Next question. Now, there is, I think I had mentioned this before, there is no cost for the durable medical equipment or the CIL services. There's no direct cost. We are a 501c3 nonprofit, so we are funded. We get some state funds, we get some federal funds. We do, because we're a 501c3 nonprofit, we depend on donations, financial donations, as well as the durable medical equipment itself. If somebody has equipment that they're not using, or let's say they had a family member that had a disability or an illness and they no longer need it, they've either recovered or sadly, people who have passed away and the family's looking to get rid of equipment, we can use that equipment. They can donate that equipment tax-free when we have forms for that. And then we can issue that equipment out at no charge. Sometimes people need things that is outside the cost of what we can afford to do based on our grant funding amounts. And sometimes we may ask you to cost share if you're able, but you're not obligated to cost share at any point if you can't or don't want to. But the services are free. Our main goal is not to make a profit. It's not to make money on anything that we issue you, and we're not going to charge you. Our whole goal is to make sure that you get what you need to be as independent as possible, and that's our main focus. And we are fortunate enough to be able to do that. So, next question. Okay, so this is important because a lot of agencies out there and a lot of organizations, when they provide services, there are certain hoops that you have to jump through to get those services. And even sadly, other disability organizations require documentation that you may not have. For our purposes and the services of CIL, you do not have to prove that you have a disability. I had mentioned before that we do not keep medical records, so we're not going to call your physician or your doctor or whoever you're seeing and ask for medical records. We're not going to ask you to prove that you have a disability. If you come in and you self-identify as someone with a disability, we're going to do everything we can to provide the services that you need. Again, though, let me just say again, if we were to refer you to another agency or another organization, again, they may have different criteria, and we can't control that. I mean, we can advocate for you, but we can't control the documentation that they require. But for CIL services, we do not require proof of disability to provide service. So next question. Now, I've done a lot of talking, and I hope it's been informative and useful. Does anybody have any questions in the chat? Or I don't see any in the chat. So if you have questions later, you can always contact us. Here's our staff. Here's a picture of our staff. And we're all committed to helping you and getting the things that you need. But you can call us, and the number's there. Or you can, if you need it, you have the relay service. Or you can email us. Sometimes when we're talking to people, or we visit things, or go to these trainings, we think of questions afterwards, and that's perfectly fine. But if you have a question, or you need to get in touch with an ILS to start the process, reach out to us. It'll get to us, and then we'll make a phone call to you and make this as quick as possible. Right now, we don't have any real waiting lists for things that people are looking for. So we can usually get you in pretty quick and get the things that you need. But I just want to say thank you to everybody who has attended. And if you didn't get to attend, of course, visit our website and find out more about us. And we'll look forward to serving you and helping you in the future.